PVRIG was identified using our computational platform as a new checkpoint in the DNAM1 axis, include also TIGIT. And what we are showing in this presentation is that PVRIG seems to be unique compared to all the other known checkpoints, the approved checkpoints and experimental checkpoints. And PVRIG has a very unique and dominant expression on cells which have strong proliferative capacity, which are called the stem-like memory T cells. And we show now using an advanced spatial transcriptomic approach that these cells with high expression of PVRIG localize to an area in the tumor microenvironment, which is called tertiary lymphoid structure, which is a structure in which local T cell priming occurs. And this is also very unique to PVRIG. So overall, this builds an hypothesis that PVRIG has a unique capacity to inhibit expansion of these stem-like memory T cells. And therefore, by using COM701, our first-in-class potential PVRIG blocker antibody, you have the potential to unleash the proliferation of these stem-like memory T cells and potentially now make tumors which are less inflamed, more inflamed due to this unique activity of PVRIG. And then in the second part of the presentation, what we start to show is the preliminary data of patients' samples of patients treated with COM701, either in monotherapy or in combination. And what we see, there are patients with difficult to treat indications, MSS, CRC, ovarian. These are cold indications which have not so many T cells inside, hardly any actually. And these indications normally are not responding to checkpoints. And what we show here is actually that PVRIG, exactly along the value hypothesis that we just discussed, is unique or seems to be unique in its ability to drive T cells to penetrate or to proliferate inside the tumor microenvironment of these difficult to treat indications. And PVRIG seems to immune modulate these patients, potentially leading now to a better clinical outcome. And we also describe in SITC in a different presentation some preliminary data of anti-tumor responses in MSS CRC patients of COM701. And later on this year, we're also going to describe the activity of COM701 in combinations in ovarian cancer patient, another type of cold tumor.